Okay, welcome, Debi, to the Dental Hygiene Basics podcast. I'm super excited to have you on and to share your RDH origin story. So, the first question that I always like to ask my guest is tell us a little bit about how you got interested in dental hygiene school, kind of that journey leading up to dental hygiene school. And then, of course, I'd love to know a little bit about what you're up to now.
Well, thanks for having me. First off, I just love your platform and I'm excited for the people that are going to listen to this and hopefully they'll take some important information away and kind of calm their nerves a little bit about if they're in school and if they're starting their little journey. It's quite the leap of faith for most people, but there's nothing to be afraid of. So I'm excited and I thank you for what you're doing because I think it's super important. I wish I would have had you before I went to hygiene school. But my name's Debi Rubino Dencek, and I'm the owner and founder of an invention called CordEze. I always thought like my journey to hygiene school was kind of up and down, which obviously life's not a straight line. But when I was younger, I kind of always thought that dentistry was something that I was going to be involved with. I wasn't really sure how it was going to look. I when I was younger, we didn't like my mom wasn't like, "Hey, brush your teeth." So like I had a lot of problems with my teeth and had to go through a lot of ortho and just, I've got crowns and root canals, I have all those things. So today as a provider, I think that's helpful, but as someone growing up, it was challenging. And so I was always in the offices and I thought I didn't know if it was just that was my exposure to dentistry or if it was going to be somewhat of a career. And I kind of, like I said, I always thought in the back of my mind that it would be something that I would do. Early in my 20s, I had a lot of bad choices to make. I was partying it up, didn't want to be very responsible. So I took some college classes. I wasn't really into it that much, and I didn't take as much away from that experience as I probably should have. But fast forward to, I had my child, lived my life, did some multi-level marketing. I did that. I owned a collection agency for a few years. I'm an entrepreneur at heart. So a lot of what I did was varied with different industries. I didn't really have a straight line to what I was going to be doing or have a real clear vision of what I wanted my life to look like. So I tried a lot of different things, which in retrospect, I really appreciate. But yeah, so I did a couple of things on my own. And then when my daughter was younger, I started thinking, she's going to be going to school. I'm going to have all this time. What would be a really good profession that would allow me to go to her events, to have that flexibility in my schedule so that I could be the mom that I wanted to be and also make a good living. And dentistry kind of popped its head into my world once more. And I started to take some prerequisites because a lot of the credits that I took early on, they didn't count. So I really had to start from square one and get my prereqs done and then apply for the program. But it took a while, I didn't go full force into it and try and stress myself out over it. I just did it over time so that I could really get as much out of the experience as I could and also do the best that I could and not just get by.
Yeah, I love that. I love that your story has zigzags to it. Those are the best stories. I think my favorite ones to share on the podcast that it's not a straight line. Some people, even if they feel like, oh yeah, it was relatively straight line, it's like really when you reflect on those moments, there's a lot that has to happen between when you decide to become a dental hygienist and when you actually become one. And I think it's really good to share those stories. So I appreciate that. And as a former party girl myself, I totally get it. And I've talked about on the podcast before, yes, I had my fun. It was all good. But my grades did suffer. And that, did impact some of the decisions and things that, made things a little bit more challenging in some areas. So I think it's good for people to hear that side of the story as well. And, they may be in that moment right now, and that's okay. We have to go through that sometimes, but also we have to think about the choices we're making, what we're hoping to do in the future, and are we putting those priorities first? So that's a really, really good point to bring up and make. So thinking about that and leading into dental hygiene school, what was your overall GPA? Because you kind of went and you started over. I'm sure it looked different than the first time around when you went to college.
When I was younger, like most people, you don't really get the full gravity of what you're doing in that moment. And that's what youth is all about. I don't look back with regret on that. It is what it is. But when I went back, I was definitely the oldest in my class. And again, I was a mom. We had a mixed bag of people, honestly. I know that prior to my class, everything was very cookie cutter. You had to have very specific uh, experiences and background. And this is just my opinion 100%. I don't speak for anybody else or even the program, but it just appeared that a lot of the people were very like into the dentistry world already and they had all this background. And I had none of that. And so, in my opinion, we were like the bad news bears. I don't know if I'm dating myself with that either, but we just had a mixed bag of people from all different walks of life and experiences that came together. It was a weird year for them because they had been changing some of the requirements for admission and different things were happening. But I was definitely the eldest and my late 30s. So I really put my nose to the grindstone and I was 4.0 and I was that way throughout my educational journey with regard to my associates and also my bachelor's. But it was a very intentional thing for me. I wanted to go back and really do the best that I can, not only just because I wanted to prove to myself that I could do it. It was just, again, having that more mature outlook on what I was doing at the time and fully immersing myself into the experience and making sure I got the most out of it. I just wanted to do the best that I could. So I studied a lot. I never cheated on a test ever. I know that's bad to say, but I know a lot of people do, especially now with AI and all that stuff. It's just so easy to kind of get your way through it and not really get as much out of it from a spiritual and personal standpoint that you can. Because, yeah, you can kind of cheat your way through it or cheat once in a while so that you can get the thing done that you need to get done so that you can go on with your life or go out or whatever it is. But as a person that had gone through so much, by the time I got into the program, I really wanted to make sure I did the best that I could and challenged myself the most that I could.
Yeah, I find that people who had that zigzag path, I was the same way. I felt like it took me a while from the first time I applied to when I got in, it was like a 7 year time frame. So I was much older than I was when I initially applied. And I'm grateful for that experience because I went into it with the same mindset, which was I'm going to give my all to this program and I'm going to make the most of it and take the most out of it. And then that might have actually annoyed my teachers because if I got something wrong, I was in their office. I was like, explain it to me. Why is this wrong? I need to know. But I think that reflects in my grades, how well I performed, and also everything I walked away with, which to me, I see that reflection in you as well. I think you made the most of your experience while you were there. And the thing is, when you step out and you graduate, you're on your own, right? You're in the operatory, you're trusted to be alone. And if you don't really immerse yourself in the dental hygiene school experience, I just think the sacrifice that's being made is on your patients. They're the ones who aren't getting the best provider that they can. If you're cheating, you're not putting in the effort while you're there. And that's really what we're there for. I like that you bring that up. And I've really never talked about cheating on the podcast before. I've dabbled a little bit in the AI. But you're right. There's a lot of ways that we can kind of, sweep things under the rug, like get through, get by. But in the grand scheme of things, we have to think about who is harmed the most by that. One, our patients, but also two, us and what we take away from the experience. And when I look at all the things that you're doing now, I'm like, I can tell you made the most and you continue to make the most out of your career in hygiene, which is exciting to me. And I'm excited to talk more about that. But I do want to kind of hone in a little bit on your dental hygiene school experience a little bit more before I get there. So, what school did you end up going to?
So I went to Rio Salado College in Arizona to get my associates, and that's where I did all of my clinical experiences and I took boards. I had a wonderful director for Rio Salado. She just really believed in me, especially when some of the instructors, like you, they were really annoyed with me because I am a problem solver by nature and hence CordEze. But even during the program, I was like, why are we doing it this way? Can we do it this way? And I literally created an electronic version of our plaque score. You know how you record the plaque? And so the director of the program just loved my innovative spirit and she really supported that. And she nominated me for, I think it was called All Academic something. I don't know. I can't remember the title. Forgive me, but there's only like 3 or 4 people in the entire state. It's nationwide, but there's just a few people selected in each state to go through and get a full ride to a university. And so she nominated me for that, and I got that. So I went to Northern Arizona University online to get my bachelor's after. And honestly, I probably wouldn't have done that just because of financial reasons. And, my daughter was obviously my main focus at the time. But because it was paid for, I went through it. And hindsight, honestly, just because we know so much more after the fact. But if you're young and you have the time and you're not tied down financially to other things that are priorities in your life, getting the bachelor's to me was a blessing. Again, I wouldn't probably have done that on my own, but God worked his will and I got it. And I'm so thankful because really when you're done with clinical, or maybe you don't want to do clinical at all when you graduate, it's helpful in other industries to have that higher degree. That said, if you want to stay in clinical, you can get your associates and be very successful in that. So Rio Salado and NAU were my two schools that I went to.
Yeah, that's great. I love that your professor was so encouraging and saw promise in you and took the initiative to kind of give you that little push, which is so nice. So big thanks to all the I call them hygiene heroes out there who are pushing us to be better and get a little bit further on our path. And I like that you shared, you're glad you ended up going down and getting the bachelor's. And one of my favorite things about the profession of dental hygiene is there is an avenue for everybody, right? Okay, I want to go into clinical, like I've got my associates, like I can go and, like you said, be very successful clinically. And then if you want to go another avenue, okay, I want more education. I'm going to get my bachelor's. I'm going to go out and do this or my master's, right? Or your doctorate. Like the journey doesn't have to end. And I think that there is an education level that goes with anything that you want to do. And I had actually interviewed another guest, Jill, and she has her associates and she went on still to become an entrepreneur and she teaches courses. And she's like, I'm in these courses teaching about cancer and oral care. And she's like, I have an associates and I'm talking to people who are doctors. She's like, so there is a way to kind of make your journey uniquely yours. And that really excites me about the field of dental hygiene. I think it's only going to continue to get better as people see that hygienists have transferable skills like yours. You recognize that you are a problem solver. And knowing that about yourself is really powerful because then you can see what do I want to solve. And you did that with CordEze. And again, I know I keep teasing CordEze. We're definitely going to talk about that. But I want to know, did you apply and get in on the first time, or did you have any setbacks leading up to dental hygiene school besides the ones that we've talked about so far?
No, I did not get in the first time. And again, the grades were there. And what I lacked in the first round of applying was dental assisting experience, which I don't even think the programs require right now. But again, when I talked earlier about everybody had pretty much the same everything that got into the program, same experience, same education, same, they were very like-minded people that got in. And so I wasn't one of those. And I may or may not have had a dentist friend uh, put something in writing that I worked there as a dental assistant a little bit longer than I really did for round two of applying. But I think it just, again, it was one of those things like, and I still to this day say, if you love dental assisting, you might not even like dental hygiene. They're totally different disciplines, just like hygienists don't want to be dentists. There's no hierarchy of, although public perception might be, that you start as an assistant, go to a hygienist, go to a dentist. That's absolutely, in my opinion, incorrect
Mhm.
because they're all very different. If you love dental assisting, maybe expanded functions might be something more in line with what you want to do. So, yeah, I didn't get in the first time. And the second time, my application may have been embellished just a little bit, just to kind of get me over that threshold. But yeah, it was kind of disappointing in the beginning, to be honest. I'm like, oh, that sucks. But at the same time, again, you have to have faith that your journey is your own and the timing's going to be when God wants you to do that. I know I keep bringing that up, but faith is really important, especially when you're going out into something like this that's going to be very, very challenging, but it's going to change your life for the better. So you kind of have to just breathe through it and appreciate each step of the way so that you're not overwhelmed at looking at that finish line because there's a lot that's going to happen in that time, not only just from your skill set point of view, but you start to grow as an individual and a professional. And a lot happens in those, whether it's 2 years or a 4-year program, whatever you choose, a lot happens physically, mentally, and spiritually in that time. So just enjoy the ride.
Yeah, absolutely. I mean, there's so many amazing things that you said just in that short little blurb. And one thing that I think I took away was, like you said, there's no hierarchy. When I started this podcast, what I realized, and I actually have an episode that's going to come out soon where I talk about, people say I wanted to do more, right? And I think a lot of people hear that and they think I should start as an assistant, go be a hygienist, and then the next thing would be to become a dentist. And like you said, a lot of people, they don't want that necessarily, but I think some people hear it and they think that's the progression. And it doesn't have to be that way. There is so much diversity in the field of dental hygiene alone that you could do so many incredible things. But I like what you mentioned, if you're happy as an assistant there and you want to grow as an assistant, there's ways to do that too, depending on the state that you're in. So really good advice that was given there. And I love that. So once you got into dental hygiene school, what do you think was the hardest aspect of it? I know you were juggling a lot.
The time factor was the most difficult for me because I had so many things going on at one time. Again, there's a saying, how do you eat an elephant? One bite at a time. And that's what I had to do. And I encourage people to do that. Even if you're going into a 2-year program, it's still a big leap in your life because the decision you're making is for financial freedom, for your professional growth, for a lifetime career, possibly more than that. So it's a lot to take in. And if you've got a job or if you've got a family or something else you're juggling with it, it could be a little bit overwhelming. So I really had to work on my time management, my priorities on a daily basis, not like, oh, I'm going to dedicate this amount of time for this. It doesn't have to be that rigid, but at the same time, you do want to make sure that when you do dedicate your time for your studies, that you're 100% focused on that and carve out that time. So for me, it was time management and just making sure that each part of my life got the best of me in that moment versus trying to mesh everything together. And fortunately, it worked out most of the time. Obviously nothing's perfect. You're not going to have this perfect situation going through it all the time. There's hills and valleys, but yeah, overall, I think it worked out really well. And trying to, obviously reach out to people that would be able to support you in your efforts with regard to the time that you can dedicate to your studies and your family life.
Yeah, absolutely. I always give it up to the moms because the moms, I mean, you're out here with a daughter, you've got a 4.0. I mean, you're rocking it, making it work in dental hygiene school. Did you have to work while you were in school as well, or were you able to just kind of dedicate time to school and your daughter?
Yes, it was all about my family and my studies. At the time, I didn't work outside the home. I know a lot of people did in my program. In fact, there was this one girl that she kind of popped in my head. She was pregnant, she had children already, and she worked, and she went to the program. It was like, I don't even know. This person is superhuman, but there are ways to do it. You just have to kind of realize that everything in life is temporary and you will get through it. Just breathe through it, focus on the most important thing in that moment, and just, take it one step at a time, one test at a time, one day at a time, one semester at a time. Try not to get too overwhelmed.
Yeah, super, super great advice. Just living in the moment. It's something we struggle with so much as humans. We're always thinking about the future or the past, right? But when I think about even my experience in dental hygiene school, it was hard to sometimes live in the moment and think about what needs to get done right now today and not feel that revolving to-do list of and then tomorrow you have this, and then the next day you have this, and then next week you have this. And it is really challenging, but we have to be the masters of our own brain and mind and remind ourselves, like, what am I doing? Why am I here? And pulling it back to that exact moment. And like you said, prioritizing what truly needs to get done in this moment. And I also think a part of that too is letting go of some of the multitasking, focus on one thing at a time. And really, it does take some of that pressure off. If you're like, right now, I don't need to worry about my phone. I don't need to worry about, this or that. I just need to focus on my studies. And I think that moms get really good at that, that prioritization of time, which is awesome.
When it comes to time management too, the things that you're learning and the skills that you learn in their dental hygiene program are going to translate into the real world application of your job and your value to an employer.
Mhm.
So it's not just getting from point A to point B and get graduated, get your boards done. It's more about developing these skills that you're going to have way beyond school. School is just foundational. They're going to teach you as much as you need to know in order to pass your boards and graduate that program. They may have 20, they may have 100 students each cohort, that they have to make sure that they all get through this program, and they have calibration requirements and code of requirements and things like that that they have to adhere to in order to get this group of people through the program and out into the workforce. So making sure that you are taking everything you can out of that, to your point, is super important because it's translating beyond that. And I would go so far as to say that graduation and passing your boards is just the beginning. You need to make sure that you are continuing your education beyond graduation. That's where all the learning really starts, because you get to start to choose what instruments you're using. You start to use off-label techniques with the same instruments that you may have in school. I highly recommend that you continue to grow and try new things, because if you're only taking what they teach you in school and using that for the next 20 years, your value as a provider and employee and your earning potential is going to be considerate of what you can actually bring to the table in terms of patient care. So think about that, not only just getting through the program, but that's the starting point.
Yeah. I mean, I could not agree more. And honestly, something I think I haven't really talked about on the podcast, obviously I'm a huge supporter of education, continuing education, in whatever way that looks like for you and your career path. But like you said, you can't just stop there. One, you don't want to get stagnant. And I think that's why a lot of people start to kind of get a little bored with dental hygiene. And the thing is, it's like there's always room for growth and opportunity and to learn and try new things. And like you said, that increases your value as a provider. And that also means you're going to be taking better care of your patients. So we see a kind of threefold benefit if you're taking care of yourself. It's better for you, better for your job, better for your patients. And I think that is something that it really is just not talked about enough, which is great. So really, really good insight there. I'm so glad that you brought that up. And um, thinking about that process, because you're obviously the type of person that has that growth mindset. You like to continue growing and learning and trying new things. So, talk me through the timeline of what happened after you graduated until you ended up developing CordEze.
Great question. Again, in the program, I saw so many things that we were doing that in my mind were antiquated processes. And that's just how my mind works. It's a blessing and a curse. Like, I can't shut it off. Everywhere I go, anything I do, I want to change it. I want to make it better. I want to make it more efficient. And so and I don't have like a super crazy backstory, like, oh my gosh, I broke my wrist or something. Like, I don't have any backstory that supports the invention necessarily, but I felt like the way that we were taught to manage our cords when we were ultrasonic scaling just didn't make sense. I mean, again, and I wasn't hardcore into ergonomics, or I wasn't injured. I didn't really have any reason to kind of follow that path of that thought process. But I just thought, well, there's got to be a better way to do this. And so, yeah, it was just out of necessity, really. It was me being in clinical and managing the cord with my pinky finger, because that's what they taught me to do. And I was like, I don't like it. It doesn't feel good, and it doesn't seem like it's the right thing to do. So I decided to take a step in the direction of trying to figure that out, and that's what led me to developing CordEze.
Yeah. So, did this thought process start in dental hygiene school, or was it kind of as you were in clinical practice, or are you not really sure? It's just all of a sudden it kind of came to your head.
I don't think it was in school, because I was really focused on automating a lot of the stuff we did on paper,
Hmm.
because we had this, I remember it was blue and red pencil that we used to use. It
Yes.
was like double-sided, and they talked about infection control all the time, and then we were using this pen, and I'm like, "Can't we do this through the computer?" So
Yes.
a lot of stuff that they have now, obviously everything's automated now and computerized, but in the time that I went to school, that wasn't the case. So I was thinking that there was better ways of doing certain things while we were in the program. But when I got out into clinical practice, that's when I really started to, obviously, using my ultrasonic scaler. I'm actually doing a CE for educators at Under One Roof this year that's going to really be talking about introducing the ultrasonic scaler early in the program into preclinic, because when you're out into the workplace, that's what you use first,
Yes.
mostly. Air polishing is definitely making a run for it, and it's great. Both techniques are great, but that's what we use primarily. And I was like, it just, again, the cord bothered me. It was always in my way. I didn't feel that my hand and my wrist were able to work as freely as I wanted them to do as far as adapting the working 2 millimeters of tip. Um, and so for me, again, it was just maybe being a little annoyed at the time, but then having those quiet moments that says, you know what, maybe if you attach it to your wrist, that would be better. And I went to a place called Michael's, which I don't know if
Yeah.
you have them where you are, but I started making prototypes. I just picked up a couple of things that I thought might be advantageous or might work in the way that in my mind's eye it was looking at the time. And one of these days, I'm actually going to do a slideshow of all my prototypes because they're pretty funny. I just started to do the proof of concept first to see if what I was thinking was really going to work. And once I proved that concept, I was like, okay, now I have to take another step in this direction and really see if I can make a product that's A, aesthetically pleasing, B, it had to be something that wasn't going to tether us to a cord, because the way we work, it has to be in and out, not only for the provider safety, but the patient safety. There had to be a couple of boxes that needed to be checked. Again, went out into the great unknown, product development, which I did not see coming. But today it's very exciting. Very exciting thing.
Yeah, I love it. And so, for our listeners, our students, or maybe someone who hasn't seen your product before, CordEze is
Mhm.
essentially, it's kind of like a bracelet and it's on your wrist. And then your cords attached to your powered instruments can rest on that bracelet so that you don't get drag on your wrist, because that puts tension on your hand. And our job is full of tensions on our hands all day long, our hands and wrists and forearms and neck and shoulders. It's all connected, right? So if you can improve the weight of that cord from putting more pressure on your wrist, it's going to increase your ability to work longer and to feel better on a day-to-day basis. And I really like your product and the way that it kind of came about, because there's something called friction points, which is like, what is something in your day that's just, it's an irritant. It could be super small, but you fix that one thing and suddenly it makes a dramatic improvement in your overall life, right? When I think of CordEze, that's what I think of. So I'm really excited for your product. And are some schools purchasing the product, or do you have any like setup for students? Like, I know I've talked about, I'm like, we got to get this in the hands of students, right?
100%. When I first launched it in 2017, I really wanted to focus on schools. That said, unfortunately, there's a lot of barriers that they have in order to put something into a student kit. I think COVID kind of changed that, where it was like all of a sudden you have to put X amount of things in there with regard to infection control. So maybe they're a little looser now. But the one thing that was interesting to me is that obviously we knew we had to manage the cord because they were telling you, hang it over the light, hang it over your shoulder, hang it over your pinky finger, whatever. So they understood and felt that there was a need for that, but they just didn't have any products available to them at the time. And the one thing I'll say is when I launched it, I felt the difference and I knew immediately. And anybody that feels the difference when they put CordEze on, it's a no-brainer. They're like, "Oh my gosh, this is incredible." But I had to, in order to support the schools being able to include this, there was a desire to have some kind of data to back it up. And I don't know if that was a CODA requirement or just the instructors really felt like they wanted to have some scientific data to support the inclusion of it. But University of California, Irvine did a study, and we did 4 muscle groups in the hand and forearm. We had the hygienist scale the selected quadrants and teeth with and without CordEze. Without CordEze, the cord pullback force measured 2.3 N, which was newtons. And I was like, oh my gosh, 2.3 N, that's incredible. I'm like, wait, what? Like, what is Newton? So, much like most of you, no one knows what Newton is. Well, maybe some of them are super smart. I don't know, but I did not know. And so I had to kind of frame that in a way of like, well, okay, what are we talking about in terms of weight? And so it's about a half a pound of weight that is exerted on our joints and our hands, our wrist consistently. And if you think of the average of your daily ultrasonic scaling might be 2 to 3 hours. That's an enormous amount of stress that's on muscles, tendons, and ligaments that they're not designed to have. And thus, 97% of dental hygienists are for some kind of musculoskeletal pain or disorder. So even students or people that haven't been in the program yet, you can go on social media and go into a chat at dental hygienists, and you can see that that has been a big problem in terms of their wrist problems, shoulder, all of that. And it's cumulative and it happens over time. So even in the beginning, if you start to feel good, you have to do things that are preventive in nature because we're preventive specialists.
Yes.
We have to walk the walk, peeps. We can't just tell our patients to do this and then not do it for ourselves. So there is data to back up the fact that this half a pound of pressure that's being put on our wrists and forearms when we're scaling with the corded handpiece. And then you talk about the HVE, which I have the CordEze pivot to manage that. I mean, that's obviously, although that was not tested, I can imagine that it's significantly more pressure that's put on our bodies having to hold that. So, yes, it seems like this year more schools are coming to me versus me trying to go to the schools. But what I would say is that some of the schools too will allow the students to purchase it on their own, even though CordEze isn't in their student kit necessarily. They'll go ahead and allow them to use it and buy it. So I can give you a discount code when this goes live so that anybody interested in using it can get a little bit of help financially with that. But yeah, CordEze really went from a nice to have to a need to have. When I first launched it, it was like, oh, wow, that's very interesting. That's a very novel invention. And oh, yeah, oh, my goodness, it does work. And oh, yeah, like everything was just really exciting around it because I always say, feel cordless and you feel the difference immediately. But now that there's hard data to support the fact that this actually, if it's being used, will help reduce your risk of injury, it really needs to be included in your day.
Yeah, absolutely. And I just love what you said about how we work in prevention. And if you're new to being interested in dental hygiene, like if you're on this career path and you're like trying to apply to school and stuff, one thing that makes dental hygienists different compared to every other like form of healthcare is that we do work in prevention. We want to prevent disease. Yes, we treat disease, but we also want to prevent it. And with that mindset, we should be thinking about that for ourselves. And the whole goal of this podcast is to educate students, help them get prepared not only for the rigors of dental hygiene school, but also that long-term thought process. I talk a lot about on the podcast making sure that your mindset's right, your mental health is squared away. You have the resources that you need going into dental hygiene school, but physical pain and prevention of it needs to be at the forefront. It's actually one of the first things you learn when you start preclinical class. They talk about how hygienists are at risk for musculoskeletal disorders, hand, wrist, forearm, neck, back pain, all of those things. And so, if there's something that we can do to improve on that and prevent that, I think it's so important. So, I hope our students that are listening, will start seeking out CordEze and looking into those resources to help just make their career better in the long run. And we appreciate, we're going to tie this episode release to a little giveaway too. So, anyone who's listening, at the time of the drop of this episode, definitely head over to social so you can learn about the giveaway. And we're always love a discount and a promo code for our hygiene students. So I appreciate that very much too. And I think the last thing I kind of want to wrap up with is maybe what would be the best advice that you could give someone on this journey, maybe a former version of yourself? What would you just kind of like them to know wrapping up for the day?
It's just such a great question because there's so many different ways to answer that. But for me, if I think about how I went through the process and my takeaways at the very end, and then obviously hindsight now, I would say embrace your differences, embrace your true calling, and it may or may not look the way that you think it is going to look in the end when you look at it from the starting point. If you want to do clinical, you can do clinical. If you want to look outside of clinical, but in the same discipline of dental hygiene, there's so many opportunities. And obviously, looking at my experience, some that haven't been developed yet, some haven't been thought of yet. So there's lots of room to create your own success within dental hygiene. And I'll kind of support that with, you might want to go into public health. Um, Maybe the money isn't as good, but it's good soul food for you. And that's what's really driving you. So really love yourself enough and respect yourself enough to be okay with not feeling the same way as everybody else in your program does about why you're there and what you plan on doing when you get out. And that's the beauty, I think, of just bringing different perspectives into the same program. It doesn't have to be as rigid and cookie cut. It could be your own experience and your own awakening. It's going to be whatever you make it out to be. So don't get so caught up in, I remember people saying, I'm going to go right into a perio office. And some people had jobs before they graduated. And I was like, oh my gosh, did I pick the wrong thing? Like, I don't even want to do that at all. And I felt like I was kind of the odd man out. I ended up temping for like 2 years straight. So my path was very, very different. And it's okay to do that. It's okay to listen to your own self, and you don't have to follow everybody else's ambitions in terms of how they see their career panning out, because yours could be completely different if you allow it to be.
Yeah, absolutely. I couldn't agree more. I mean, reflecting on my own career, I feel the same. And I think that's a big part of why we do the podcast. And I think about when I started dental hygiene school, I didn't really know what was even possible. I really thought I was going to be working in a clinical setting for the rest of my life. And then as I got to see my teachers, I was like, oh, now I could be an educator. Like that thought never even crossed my mind. And then I was like, oh, wait, there's people in public health doing this. And I think that there is a way to, when you're going through dental hygiene school, as you're learning more about the profession, and hopefully as you're listening to this podcast, you see something or you hear something that sparks a passion or at least an interest in you. And don't be afraid to pursue that because it can lead to such incredible things, right? And your passions can change, develop, grow over time. I know I thought I was going to work in formal education. I thought I was going to live and die at the university. And obviously, things have shifted in such a beautiful way. And I'll tell you, Debi, it's exactly for the reason that you said. You mentioned that you have to give yourself quiet and time to be given those opportunities, right? And that was exactly what I did. When I start to feel like things aren't going the way to feel like right or aligned with me anymore, the first thing I do is get quiet and I give myself space and I just trust that whatever the next thing is that's supposed to come comes, and it always has. So I think that that was a really beautiful sentiment. Like it's okay to slow down and to just listen for a while, to yourself, to the universe, whatever it is that's talking to you. So wonderful advice. I've just loved having you so much on the show, and all of your insights have been incredible. And I have to give a huge thanks because you did donate to the Dental Hygiene Basics Scholarship. And so for anyone that's listening, just so you know, our goal is to give out $100,000 in scholarships by 2035. We have already given out 3 scholarships. We're giving out 2 more this year in 2025, and we've already got funding for 2026. So very exciting time for our students, and it could not have been possible without you, Debi. So I appreciate you so, so much. Thank you.
Oh gosh, it's my pleasure. I was the recipient of it, and I know how important that is to a lot of people. So thank you for doing that. That's amazing.
Of course. All right. Well, thanks, Debi. I appreciate your time.
All right. Thank you, Dana.